Hi, welcome to our mini lecture on the internal focus for change. This mini lecture is meant to be watched prior to our fourth class together. And the purpose of this mini lecture is to discuss how we approach change with our clients and then how we encourage change with our clients. So kind of setting the scene leading up to change and then how we actually attempt it with our clients. So once the collaborative working alliance and rapport are established, we begin to really encourage introspection. And the goal here is to help clients shift their focus away from the behaviors or reactions of others to that which they can control. So shifting the focus away from other people and onto self. So kind of the idea, you can't change them, but you can change you. So here's some statements that we might typically see from clients talking to us about others. It's important that we always validate these types of statements. There can be a lot of pain, shame, distress in statements like this. And so in validating, we show the client that not only are we there with them, we're listening, but also that we believe them, that these things are really happening for them. So our goal is to create a new internal dialogue to help clients create different responses to these distressing patterns that keep coming up for them over and over again. And we do this, of course, through dropping into process. And when we drop into process in this way, clients know that we're paying attention, that we're tracking, that we're right there with them. And it also helps expand the client's focus away from the other and back onto self. So we always, of course, want to be joining with our clients. It's not our job to fix our clients' problems, but to meet our clients where they are, to stay curious, to remain willing to understand their experiences. And the combination of that and collaborative treatment, collaborative meaning shared ownership in the treatment, leads to self-efficacy. Self-efficacy is the old teach a man to fish adage, the belief that we can help our clients learn these new ways of being, and then they can take that out into the world. So as humans, we tend to avoid pain, but with clients, we need to be able to enter into the painful place that is their world. And so we do this through finding points of entry. I think of points of entry as like a little door in the conversation. You're hearing the story, and then something comes up in what the client is saying, and you suddenly realize that that's something that needs to be explored more. So we're always looking for ways to drop into process, and points of entry are a way to do that. So you might hear your client share feelings of pain, shame, sadness, loss, experiences of disappointment, betrayal, humiliation, invalidation, discussion of family or developmental issues, certainly trauma, relational patterns, something like, I can't seem to find a nice guy, they all cheat on me, putting oneself down, something like, I just can't seem to get out of my own way, I always do this. You really want to pay attention to statements like this and not shy away from them. Easier said than done, especially for a beginning clinician, but you will develop the capacity to hear these types of statements, and you'll also develop the confidence to really walk through that door to explore more with the client. So our client should always be the one in charge of telling us what needs to change, but it's our job to encourage them and guide them to being able to identify this change. And one way that we do this is through refocusing. And refocusing is making order out of the content and redirecting to process. A great way of doing this is by tracking our client's anxiety. Anxiety is really valuable. It's an innate alarm bell in our body that tells us when something needs attention. Anxiety also provides a point of entry, one of those doors that we can start to explore with our clients. And our textbook provides a good 4-step sequence for tracking anxiety. So the next 4 steps are based on what's in the textbook. The first step is to identify both obvious and subtle signs of anxiety. Does the client feel safe? What makes them feel anxious? We really want to establish their window of tolerance. And anxiety can show up in a lot of different ways. So it's important to check in with our client to determine what's based in feeling and what might be a cultural norm. So something like eye contact, body language, how loudly someone is speaking, how quickly they're speaking, and a ton of other things can be all normal in one's culture, but could look like anxiety to another culture. So it's important to check in with our clients always. So we want to approach anxiety head on. We want to be direct with this, focus our clients inward as they're experiencing their anxiety and really explore it together. Now, of course, this could intensify anxiety or induce resistance. So in that case, we want to pull back, explore what doesn't feel safe, and then once safety is reestablished, we want to try this again. We want to observe what triggers our client's anxiety, and we do this collaboratively. We want to determine what brings up their anxious feelings, and this shows us what they're really struggling with. Now, if it's the therapist or client interaction or relationship that's triggering it, we want to break it down. What and where did this threat come up? How did this happen? And how should we address it in the future? Finally, we want to focus our clients inward to explore their own anxiety. Now, as therapists, we're always connecting dots, linking patterns, but now we want to invite our client in to do this collaboratively. This helps to ensure the therapeutic relationship doesn't repeat problematic patterns. And it also brings in this self-efficacy idea that clients can model positive and productive behavior with the therapist and then take it out into the world. So we really want to approach this process as asking our clients to let us into their internal world. And doing so moves us from surface conversation to what's actually going on. And when clients focus less on others and more on themselves, it opens up a whole world of possibilities and change. It's a real sense of autonomy. So doing this together is the shared ownership between therapist and client, and that leads to the self-efficacy that we're hoping for. As always, our goal is to ensure that clients feel fully seen and fully met in every intervention, in every interaction. If anything in here needs further clarification, please let me know. I look forward to seeing you in class. Thanks for watching.